how do you apply the physical activity guidelines, I guess, is where I'm going. And I guess, Sarah, to start with you, really, do you find the UK, this is probably a controversial question on this podcast, but do you find the UK CMO guidelines for physical activity useful when you're discussing physical activity with inactive people?
I think they're really handy, and actually I think a lot of healthcare professionals could make more use of them. There are some fantastic infographics that you can order on the website, and you can stick up around the surgery. You might want to have a set on the desk in front of you because it's just a really good conversation starter. I think that quite a few people are not certain, even if they are active, how active they should be. Are they active enough? Sometimes you get worried well asking you that question, and sometimes you get maybe people who are not active at all, who have no idea what they should be aiming for, and actually being able to give them that really clear answer of 75 minutes of vigorous activity per week, or 150 minutes of moderate intensity activity, or a blend of the two, is what they should be aiming for. And it's important to realise that actually for some people who have got low physical activity levels, that is a really big ask. So it's important to just really support people. Quite often I actually say to them, we all find it hard to be as active as we can. Most of us could probably fit in more exercise than we do, and that would be good for our health, myself included. So I really try to level with people rather than it be me telling them what they should be doing.
Yeah, thanks, Sarah. And that's really useful. So I guess if anyone listening hasn't seen the Chief Medical Officer guidelines, obviously there'll be links related to this, so do have a look. And as Sarah's pointed out, there's 150 minutes moderate, 75 minutes of vigorous exercise, and we've got our resistance training sessions as well in there. And the rest of the details you'll be able to find when you have a look at the information. So I guess taking that forward, as Sarah's kind of mentioned here, this is not for everyone, but this is a guideline and a place to start. And I guess, Josh, it's how would we encourage people to introduce the guidance into a consultation? What would be a good way to do that?
Yeah, so I think once you've sort of initiated those conversations, and maybe you've had some buy-in from the person you're working with, that maybe it's okay to talk about physical activity, then again, I think it can be helpful to maybe try and dispel a few myths, because again, I think the term moderate intensity activity can include things like brisk walking, and some people might have quite sort of unhelpful ideas about what counts as exercise or what counts as activity. I think sometimes just kind of mentioning that to people can be quite freeing in terms of what they feel able to do. I think as well, the use of infographics is really helpful. Again, handouts, things you can give people, just brief snippets of advice, like, for example, exercise and physical activity can be a really good treatment for depression. So if you're seeing someone in a mental health context, actually just having that piece of info, it can just help, again, think about how to introduce the guidelines, and just kind of have it as something that's going to be brought up throughout the sessions and throughout the time you're working with someone.
Great, thanks, Josh. And then I guess taking that forward, Michelle, kind of how would you encourage fellow healthcare professionals to introduce the relevant guidance? So kind of, when would you do it and how would you do it?
I would really following on from what Sarah said, really, is using the infographics. I like to have a copy on my desk and posters around, but also so that you can actually have something to look at. And I like to use them. I think they're really effective when you actually look at the statistics of how they help reduce people's risk of cardiovascular disease. And when you start to use statistics, for some people, that's really motivational to know that they can reduce their risk of cardiovascular disease by 35% by being physically active and getting to the government guidelines. So I kind of use the infographics a lot, and using the key messages, like things like where we say that some is good and more is better. I think that's really powerful to let people know that any is good, in case people still think that they have to do an awful lot to get some benefit, and also that every minute counts, and that make a start today. Those are the messages I really like to get out, because that's kind of, I think, frees people up to know that it is within their ability to make a difference.
Yeah, perfect. And I think that's a great point you make around the messages, which hopefully are in some of the infographics as well, but that kind of every minute counts is one of those kind of critical messages, and a little bit of a shift from the previous guidance as well in that sense. So No, definitely. So I guess kind of summarizing what many of you are saying, in many ways, the guidance is just one element. It's a useful starting point. And a lot of you are saying that you use it in your consultations, or you've got it stuck on walls as a conversation starter. But it's about getting them towards it, and not necessarily always that they must achieve it immediately, which might not always be realistic. And I think that's an important message for us to get across to healthcare professionals as well.